World Cancer Day. But at Molar Bear Dental Studio, we aren't here to talk about the battle once it begins. We are here to talk about the shadows. In my years as a clinician here in Pune, the hardest conversation aren't about the diagnosis. They are about the wait. Waiting for the patch to change, for the lesion to grow, or waiting for a biopsy. Today, the wait ends. I am introducing a technology that allows us to find the oral pre-cancerous lesions in their shadows. And more importantly, diffuse it using nothing but just light. We are moving from detection to reversal. If you have 10 minutes, stay with me. It could save your life. Most oral cancers don't start as cancers. They start as minute little changes in the tissues of the oral cavity. These are the cells that are losing their way and moving towards the dark finish line. Traditionally, the medical world tells you to wait and see. But in my opinion, wait and see is just giving the lesion the time to grow. Type heal in the comments if you believe we should stop the disease even before it begins. I want to see how many of us are ready for the new standard of care. This is the Novolace oral blue device. It's a masterpiece in theranostics, detection, and therapy in one device itself. It uses light in the first place to reveal what my eyes cannot see. That is, the shadows that I'm talking about, shadows of the precancerous lesions. The miracle here is, once we find those changes, we don't reach for a scalpel. We use photobiomodulation. That is the therapy part of this device. This specific wavelength of the light enters the tissues and it communicates with your cells. It triggers the cellular reset. It doesn't destroy, it heals. It reverses the dangerous changes and brings the tissue back to its original health. No pain, no surgery, just the power of light. I'll show you how we will do this. Just imagine a dental checkup which does not just check for the cavities in your teeth, but it actually screens for your future. With this device, the oral blue device by Novolace, we can identify a high-risk area, that is the high-risk lesion, and begin the healing protocol in the same session. This is how we ensure that a precancerous lesion never becomes the headline of your life. I will show you how we use this device. So, we have the optical glasses to actually see the changes that I'm talking about. So, we wear this. So, this is your oral cavity that we say. These are the tissues per se. Okay. So, this is the device. Okay. First, first I will check for the shadows, that is the changes that I am trying to see in the precancerous stage. So this is how the blue light will help me, and I can see the changes through the optical sunglasses, that the glasses that I'm wearing. So this is how we check. We check for the lesions on the tongue and the other parts of the oral cavity. And once I have detected the changes, with the same device, I will use the photobiomodulation, that is the other mode, that is the red light. That will heal those changes that I'm talking about. So this is how I will run it through. So basically, what I'm trying to show here is this is a technology that is first in the city, wherein I am actually trying to diagnose the oral cancer stage at a very, very early stage, where, like I said, what we see is actually a very advanced stage, what everybody talks about, the cancerous lesions that we see in the oral cavity. Here I'm talking about those minute changes that we cannot see through white light or naked eyes, but through this device with the help of blue light, with that typical optical glasses that are required, wherein I can actually tell you if I can see the changes. So if this is done routinely along with your other dental checkup, just imagine the change. I will be trying to tell you that if I see any changes, we can immediately start the procedure to treat it, to heal, and make sure that those changes do not progress to a stage that everybody knows about. That is the cancerous lesions, which is why this is a breakthrough. Because it is World Cancer Day, I'm not just sharing this for likes. I am sharing this for a particular impact. Oral cancer is a silent epidemic, at least in our country. But today, we have the Defusal kit. Here is our World Cancer Day commitment at the Molar Bear Dental Studio. If you know someone who smokes, chews tobacco, or hadn't had this type of screening in a year, share this video with them right now. You aren't just sharing the video, you are sharing a reset button. We are opening exactly 50 slots this week at our Karve Nagar clinic for search and heal screening. We will prioritize those with visible patches and or a history of tobacco. Kindly DM me the word shadows right now. That way, my team is standing by to book the screening appointments. So do not wait for these shadows to grow. Diffuse it today. I am Dr. Maitreyee Bhosle Shah, and I will see you at the clinic. Thank you.